So let's talk a little bit about the people you're trying to get the food to.
Yeah.
How many people, and I know I've heard this term before, food insecurity.
Yes.
Could you explain what you think of food insecurity as being, and how many people in New Jersey do we say are food insecure?
1.1 million and growing. It is a lot of people in the state of New Jersey. And people think of New Jersey as a wealthy state, and it certainly is in pockets, but also every single zip code in New Jersey. Like there are towns where people would say, oh, nobody there is food insecure. They are. Because food insecurity, the reason we use that term and not hunger is because what we're talking about is consistent access to healthy, culturally appropriate food that enables you to live your life in a thriving way, so that you can go to work, that you can go to school, that you can do all those things. Hunger is more of a physical sensation, almost like we've all felt hunger. That's very different than knowing that you're going to be able to feed your family healthy food that is going to help them develop properly.
And it's over 1 million. I think there's 9 million people in New Jersey,
yes.
right? So it is a significant amount.
It absolutely is.
And that's probably grown since COVID, is that?
It has grown significantly since COVID. And a lot of it, it's complicated because people always ask that, like, well, why is it? And everything has gotten so expensive. Rent is more expensive. And especially when you do live in an expensive state, those things really hit. Right now, gas is something that is just so expensive. Groceries, childcare, as you certainly know, is a very expensive thing for families. And so, food is available. You can go to a food pantry and get food. You can't necessarily go to, somewhere else to get somebody to give you rent money. There are some programs, but it's much harder. So I think people do turn to the charitable food system when everything else is putting them at a breaking point.
Would people be surprised if they knew who the 1.3 million people are? Like, what are the myths about who is suffering for not having enough food?
Absolutely. I mean, yes and no. I think nobody's surprised that a lot of it is people who are living in poverty in general, who are just at that line. But so much of it, and we saw this in November when the shutdown happened and people's SNAP benefits were cut. So many people in the lines that came, and the lines were miles long at the distributions that we did, said, I've never asked for help before. That it was just they're living close enough to the edge that having those SNAP benefits go meant they had nowhere else to turn. And so it is working families. I mean, 80% of the people on SNAP are working families. I don't think people understand that when they hear about SNAP cuts. They think it's somebody who's, asking for a handout or not willing to work. But most people are, some more than one job. Like one of the biggest searches we get is what pantries are open in the evenings, because people need to go after work or after picking their kids up from school. So I think that part is surprising to people. And how much could be a family that that was doing fine. And then somebody got really sick and had health bills that they couldn't cover, or somebody got in a car accident and had to buy a new car. Somebody got laid off, not expecting it. And all of a sudden they find themselves in that situation. So it's pretty eye-opening when people come to pantries.
So you mentioned SNAP benefits, which I understand to be the Supplemental Nutrition Assistance Program, which, just for our listening audience, is what we used to refer to as food stamps,
exactly.
Right? Now, that's an income eligibility program. So what you're saying is the point being that it's many people who are working but close to the poverty line, right?
Exactly. And it depends on the number of people in your household and, all those things. So yes, it is income. And it is one of the other myths that we like to dispel. It is only for citizens. So it used to be that people on refugee status could get SNAP. They no longer can as part of this bill. So I think one of the myths is, undocumented people are stealing all this government money. It's simply not true. There's a very low fraud rate in SNAP. It's known to be one of the most efficient programs. And so I think it's just really important that people understand that when they hear about these SNAP cuts.
So, and refugee people are people who are here legally.
Absolutely.
People who have just wandered over the border and undocumented, as you point out, have never really been eligible for SNAP benefits or other.
Right. And the SNAP application, like if someone sat and went through it, it's a lot of information. So it is not like somebody could just say, oh, yes, I'm a citizen and get food. I mean, it requires a lot of documentation, which is why we have staff who are going out and helping people with these applications, because they're complicated.
So you have staff that does that?
Yes.
Who are those?
They're called SNAP navigators, and they go out. Mostly we'll work with some of the pantries in our network we go to schools, we go to different social service organizations, and we try to have them announce to people in advance that we're coming so that they will bring their documentation if they have it, but they can upload it on their own later if they know how to do that. Not everyone does. Or we can come back, or they can call us and we can walk through it. And then we also have a mobile unit. So our SNAP mobile unit can go sometimes goes with our mobile pantry, so you get both in one place, but sometimes goes to senior housing or some of the hotels in South Jersey where people live, and really sort of try to work with them to get them benefits that they're eligible for.
And then you mentioned the fact that there's SNAP cuts. Now, my understanding is it's that the eligibility has changed, right?
Yes.
So there are some people who are here, a certain refugee status, who are no longer eligible for SNAP, but there are other requirements, a work requirement now, right, that is changing.
Exactly. And certain populations that used to get a waiver from that work requirement that no longer do. So veterans, we know that a lot of veterans are living with mental health challenges that they don't get, a diagnosis for, that they're not willing to do that. There's still a stigma, unfortunately. People aging out of the foster care system, same. We know how much those kids struggle. And so they used to have a waiver and no longer will have that waiver. So there are very vulnerable populations that we're very worried about as these go into effect. And it's not even just, people are willing to work most times. It is that the paperwork that's required and the kind of compliance that's required, and that it has to be 20 hours every week. Whereas, we have people who do seasonal work. That in the summer they might work tons and tons of hours, but there's not as much work in the winter. Or we had a woman who was at one of our pantries who was a school bus driver. She works year round. She doesn't have work in the summer. Those people can actually fall out of eligibility now because they cannot meet the every week requirement. And if you miss it for 3 months, you are not eligible even to apply for SNAP again for 3 years. So we're really very, very worried about the number of people that are going to start turning to pantries because they have nowhere else to turn.
And how are people learning about this requirement? Which I understand it's work or going to school or you can volunteer, but to your point, you still have to document it somewhere and it's got to be uploaded. I don't know that we have figured out all those logistical things.
No, we haven't. And 20 hours is a lot to even as I said, we use tons of volunteers. It would be hard for us to absorb a large number of people to volunteer 20 hours every week and document it and give them a meaningful, work experience there. So imagine for very small nonprofits, like having volunteers, maybe 1 or 2 for 20 hours, but you're not going to be able to reach large segments of the population. To answer your question, how are people finding out? Unfortunately, many are not. And the way they will find out is that they will no longer get their SNAP benefits. And there's a few reasons for this. Information is sent out. It is not very digestible. Unfortunately, we're trying to work with the state to have everything go out in no higher than a 4th grade reading level and to go out in multiple languages. That's been slow to happen and not even the fault of the state so much. It took a while for the guidelines to have clarity from the federal government. But I think people don't always read their mail and, we all should, but I'm sure I've missed a thing or two in my mail. I think that happens to a lot of people. And so they don't know. And at some point they will just not be eligible anymore, which is very scary. So lots of social service organizations trying to make sure that people who come to them know. We have a program called Snapshot where we're trying to get information out to people. I know some counties have great social media, text alerts, et cetera. So everyone's trying to inform people, but I think we still every day have people who come to a pantry and say they had no idea that this was changing.
What do we do about it then?
Yeah, we keep trying to educate people. And I think use as many venues as we possibly can, like digital ads, like social media, like word of mouth, like getting somebody who has a WhatsApp group with their community that is in Spanish and they can get word out to people. So really trying to use grassroots kind of movement to get people to know. We are going to probably have people knocking on doors in communities where we know there is high SNAP usage and leaving materials, making sure that people understand. And we'll have QR codes to the government forms so that they can find out exactly how it applies to them because it's complicated. But we just want people to know to ask because right now people don't even know that they need to ask and that they need to understand that it's changing.
Just as you're getting me thinking, are there social media influencers, anybody who's taken on this food issue?
There are certainly something called the Snap Challenge. We've had a few influencers who've done that, which has been very eye-opening for people, I think. And I've actually done the Snap Challenge. It's hard. The challenge is to live on $6 a day for all of your food. The challenge is to only do it for 3 days. And it was hard for me to do it for 3 days. So imagine if that's your life. I mean, how difficult that is. But so we definitely had people when the HR 1 was going to be passed and we had people calling all the time and trying to get it not to be passed. The influencers, I think, were great for that, for getting the word out and making people understand this is not a huge amount of money for a family. I think, again, sometimes people have this conception like, oh, they're just sitting there getting this handout. It's $6 a day on average. So it's really just to supplement and to help people who can't make it to that next paycheck. And so I think once you try to live on $6 a day, you understand what families are going through.
Do you have any thoughts on what is the impact on child development, on learning when kids don't have consistent, nutritious food?
Yeah, we talk to educators all the time, and it is kids who come to school hungry, often can't focus, will fall asleep sometimes, will come to school and, they've had kids, kind of having to try to go to get the breakfast or lunch, even if their parents haven't filled out the eligibility forms yet, which is why universal eligibility would be such a wonderful thing. And plus, there's still a stigma for kids sometimes about those school meals. It absolutely not only has an impact on kids today, which it does, certainly, their ability to thrive in school, but more and more the research is showing that even short periods of food insecurity in childhood can have lifelong impacts. So physical and mental health. The shame of it, the living that way, the anxiety of not knowing where their next meal is coming from, and then just the poor nutrition. Even kids who aren't necessarily hungry, as in their stomach is full, unfortunately, cheap food is usually not as nutritious. So when families are, working 2 jobs, rushing to do things, they are more likely to have fast food or whatever they can quickly find that is relatively affordable, but not necessarily nutritious for kids. And that, too, has lifelong impacts. I mean, the impact of diabetes and high blood pressure are going to keep people out of the workforce as long, are going to really sort of cause problems for the rest of their lives.
So I know the school meals program is fairly successful, right? And there's meals that continue into the summer. But I also know from our Kids Count data, only 60% of kids who are eating lunch are also eating breakfast, right? So there is some, not consistency or inconsistency in terms of making sure kids are getting meals at school.
Yeah, and there is some work being done to try to get a bill for universal breakfast, or at least to have free breakfast available in school, and what they call, I forget exactly what they call it, but breakfast on the go, basically. So I think it's breakfast in the classroom, so that somebody can get something that they can take with them, because it's hard to, if you're already getting your kids to school, getting to work, can you necessarily get them there earlier? It's hard for some families. So something that they could eat, in their homeroom period or something. Yeah. And it does make a big difference. I know New York City saw a huge change, and it helps attendance. Honestly, when kids are going to get meals at school, the family is more likely to do anything they can to get them there.
Oh, that's interesting, because we do have a chronic absenteeism problem, right? So
exactly.
That's the way they solve that.
Yes.
What about the older kids? What about the college kids? Do they have a food insecurity issue too?
I'm very glad you asked, because it's huge. They say 1 in 3 or 1 in 4 college students, which is a mind-boggling number, struggles with food insecurity at some point in their college career.
Now, is that nationally?
That is nationally. But New Jersey definitely mirrors that. And yes, it's more in community colleges and things, but it is every single university. Because, a lot of people you might get a scholarship to Princeton. Maybe you even get a scholarship with room and board. But if your family is living in poverty, you might still struggle. Well, I guess not if you get room and board, but if you just get your tuition, then, getting gas to drive there, getting housing, getting all those things are really a struggle. So kids, you wouldn't necessarily think that students at Seton Hall and Rutgers and Princeton would struggle, but there are food pantries there that we work with to try to make sure that those young people can, and not always young people, it's adult students also, but can get food, because we want them to stay in school. And, that's the path that they're going to take to not be food insecure at some point, which is the goal at all of our pantries, is to have people get to a point where they don't have to come back to us. And so the college pantries have just been amazing, and really trying to work so hard at not having any stigma involved, making sure that people feel welcome, that they can go there and get some of their meals or groceries or toiletries.
So are you at all concerned, as the SNAP work requirement changes, that the food pantries, the need might increase and they won't necessarily be able to fulfill the need, or the wholesaler, the Community Food Bank, isn't going to have enough food to supply the pantries?
To say I'm concerned would be quite an understatement. Yeah. I mean, starting today, really, because the work requirements went into effect 3 months ago, people had 3 months to get compliance. We expect that in May, people will start to be removed from SNAP. For every meal that we provide, even though we provide about 100 million meals, and the other food banks add to that, SNAP provides 9. So when you think about what those SNAP benefits are doing, first of all, it's keeping people out of having to come to pantries, which is not the best way for people. You don't have as much choice. If you can go to a grocery store and have something to help, that's probably better for your family. So we cannot absorb that much if SNAP were to disappear, which in some states it might. New Jersey will not let that happen, but there will still be some SNAP benefit. But yes, we're incredibly concerned that we will not be able to serve everyone at the food pantries.
Thank you so much for watching. Check out the full conversation by clicking the link in the top right corner or the link in the description. And be sure to leave a like, subscribe, and hit the bell if you enjoyed the video and want to be updated when our new interviews are released.